Did you know that more than 20% of the world's population suffers from migraines, but most people don't talk about it openly? The reason is absolutely less information about this disease. It has been found that many people are misinformed and indifference between migraine disease and normal headache is not seen or understood. According to the UK-based Migraine Trust org, this disease is most common in people between the ages of 18 and 44. Studies have shown that this disease of excessive headache is more common in women than in men in a ratio of 3:1. Studies show that the variability of hormones in women and different lifestyles are the reason for this. What are the symptoms of migraine? Occasional severe headache, irritation with headache, not wanting to talk to anyone, don't like to go in crowds, inability to see in sunlight or excessive light. Some people experience pain in only one half of the head, right or left, while others experience pain in both sides. Pain as if the veins in the head were swollen or cracked. Migraine effects. If you're lucky, a migraine can last for 4 hours or as long as 72 hours. For most sufferers, migraine is a chronic illness that significantly reduces quality of life. When the pain is repeated 10 to 15 times every month, there is a possibility of overuse of painkillers. As a result, the body's ability to fight drug addiction and other diseases decreases. Also, due to repeated migraines, the person has other problems like depression, anxiety, and insomnia. According to doctors, migraine sufferers should pay close attention to diet, rest, and behavior. The only way to prevent or reduce the effects of migraine is to remove or stop the migraine trigger as soon as possible. Migraine triggers. Different people may have one or more different migraine triggers. Among them, there is a possibility of migraine in the case of lack of food or staying hungry for a long time and lack of water in the body. This disease is also triggered by consuming caffeinated drinks or food like coffee, cake, chocolate, etc. Disturbance and unpleasantness related to the organs of the head, eyes, ears, nose, mouth, or tongue. As mentioned before, along with the food, noise, overly bright matter, odor, or some kind of particular smell also affects. Likewise, changes in daily life habits such as disturbances in sleep-wake, meal times, exercise schedules, etc., enough rest for the brain, overthinking, worrying, a favorable environment, and negative news can also trigger migraines. In women, especially, hormonal changes can increase such pain. Migraine and psychiatry. Migraine disease is still a very poorly understood disease. Most of them consider it as a common disease of headache. On the other hand, because of this, a kind of feeling of inferiority is created in the victims. A simple cetamol pill or two does not relieve the pain as expected. As a result, thoughts such as, "How weak I am, I can't bear a headache," or "Why does this happen to me at home?" weaken self-confidence and self-confidence. Self-esteem and confidence, as well as loss of patience, ability to read and write, and other life skills or talents also decrease. In the end, you have to live with the feeling that your life has no balance and value. That's why if you or someone close to you has a migraine or a common headache at home, it is a proper life-saving action to see a doctor and get proper treatment.